Hey guys, what's going on? This is John from Friends with Your Benefits. It's been said that 25% of employees over the course of their work life will suffer from some form of depression. But how do you know whether or not you're going through something that is clinical in nature or just an everyday stressor? Joining us today to learn more about that, we have Raquel DeLuccia, therapist and host of the podcast series Feel and Find Out. Hey Raquel, how's it going? Welcome to the show.
Hi, John. Thanks for having me.
Of course. So, Raquel, before we get started, why don't you tell our audience a little bit about your background? How did you get started in therapy and what do you do on a day to day basis?
Sure. So, I'm a licensed marriage and family therapist. I have been practicing with my license since 2017, but I've been in mental health as a whole since 2007. So, I have another master's in general psychology, and I've done a lot of work with that in community mental health. And then I went back to school again to focus on relationships, getting more extensive experience working with trauma and couples. I own a private practice in Arizona, in Phoenix, Arizona, and I see couples and individuals there.
Cool. Out of curiosity, are you just licensed in Arizona or can you see people in states aside from Arizona, like virtually?
Just licensed in Arizona. So yeah, if some clinicians, say clinicians in New Jersey, they might have a license outside of their state, but it's not the easiest thing to do for us. So yeah, just Arizona.
Very cool. So let's get right into it, right? So, as you heard me mention, unfortunately, a good chunk of the workforce, about a quarter, the study out there says that about 25% of employees will suffer from some form of depression over their
Mhm.
work life. Does that surprise you?
No, it does not surprise me.
So let's go through that, right? So like, it's tax season, right? And a lot of people are stressed out from taxes. It's finally in New Jersey starting to get nice. People have to go outside,
Mhm.
spend more time with their kids, and there's a lot of everyday stressors that are going on. But how do you really separate, everyday stress versus something that's more clinical in nature where you may need to talk to someone professionally?
That's a really good question because depression is a clinical diagnosis and you have to hit certain criteria to meet it. So, feeling down or feeling sad or feeling overwhelmed is not necessarily indicating that you have clinical depression. But if you are so low energy, fatigue, hopelessness about life, about the future, that's a big marker of it. Difficulty eating or overeating, difficulty sleeping or sleeping too much, and then even times, thoughts of wanting to end your life. And when these happen all together, usually for about 2 weeks straight, is when clinicians are like, okay, we're looking at clinical depression. And people can often, because depression is a mood disorder. So people will not necessarily just live in that low state. They may have a baseline that's a bit above that where they can function, but when they dip down and they're not functioning very well, that's more often a sign of clinical depression.
So, how, as a therapist, out of curiosity, let's say you're talking to a new patient and you
Mhm.
believe that depression is something that they're actually going through. How would you treat that?
So, first I want to know, how long have you been experiencing this? So, has this been something that's happened on and off since you were young? Has this been more of an adult onset? Is this circumstantial? So, the things you're talking about, like stressors in the workplace, are you just completely overwhelmed by life and your job, so that we're looking at more of inability to adjust or adapt to circumstance rather than clinical depression. But to treat it, so I'm going to want to know the origin of it. Is there family history of it? Because sometimes it just shows up and it's absolutely not circumstantial. It feels very much out of one's control. And so, first getting to the origin, figuring out, is there some type of trauma that we can link depression to? Um, Oftentimes, things that happen early on in a person's life can accrue over time, changing the brain chemistry, changing the way that neurotransmitters receive and transmit things like dopamine and serotonin, norepinephrine. And so I want to know what happened, and can I use, you know, EMDR to treat this. Traditional talk therapy can be really good as far as like providing support, providing strategies to function a little bit better. But I often suggest people get on some medication, to be quite honest with you. I'm a therapist who believes in the effectiveness of medication when prescribed appropriately. So those two things together, medication and ongoing therapy, can be really helpful.
Yeah, there's been a lot of talk, obviously, coming out of COVID that during the COVID, there was an increase in depression and overall,
Mhm.
I guess things happened to bubble up. But now we're kind of out of this COVID state. Life has so called resumed back to normal. Are you seeing that depression is still staying at high levels or has it leveled off a little bit?
I would say it's as prevalent as it's ever been. And the thing is I've worked in a lot of different settings. So I think that the setting I saw depression as probably the most um, prevalent would be in substance abuse and addiction. I know it's probably a whole nother topic, but oftentimes individuals who struggle with depression will turn toward substances to cope. Um, so as far as COVID goes, I think at this point I'm not seeing as much um, symptoms related to adjusting or adapting to that crazy time we went through, as it's more just life. Life and learning that, hey, that thing that happened to me or that thing I saw or went through 20 years ago, actually I think that had a big impact, and now that I'm aware of it, I'm feeling some of the effects.
Finding a therapist, I personally believe, is something that's an extremely important decision. And it also, I think, takes a lot of guts, right? For someone out there to admit,
Mhm.
hey, like I need help. And this is not necessarily that's something I'm seeing a medical, doctor for, but I need to
Yeah.
really, talk to someone to find out and deal with the root cause of my issues. And then just as, a brief side note, I'll admit that, a few years ago I got a divorce and I ended up talking to someone and it really
Mhm.
made a world of difference. And after, a few sessions, I was able to, get my life back on track, thankfully, but not everyone's there. So Raquel, I guess question for you, right? So each person out there has different needs. How do you actually find a therapist that works well for you? So like an everyday person out there, do you have any tips on what qualities that they specifically should look for based on perhaps what type of issue they're dealing with?
Yes. I actually just recently wrote a blog about this on my website about finding the right therapist for you, because it really is important. So when you're looking at, okay, I think I'm finally ready to talk to someone, to open up, to get some help with my mental health. One is I really like the platform Psychology Today. It's a
Okay.
website. You can literally just put in your zip code, your insurance if you want to use insurance. Um, if there's a specific type of therapy you're looking for, and if you're brand new to therapy, then just kind of read each person's profile. We have a lot of acronyms in our world of the type of therapy we do, and so it can be a little overwhelming. But there are specific therapies I recommend over others that I think are typically more successful. So, someone who has a background in trauma, because, you know, trauma isn't just that huge incident that happened, right? That assault, that accident. It's actually smaller things that maybe accumulated over time in one's life that is now impacting how a person sees the world, sees themselves, is able to relate to others. And so a therapist who's trauma informed, and that should be pretty explicit in their copy, like in their website, in their bios. Um, as far as what you can afford, we all have different price ranges, and some therapists will take your insurance. I would just read about what they offer as far as the modalities, the trainings they've been to. Like, we all have to take continuing education trainings every couple of years. Some of us do that way more often to get certifications, and we're always trying to learn and meet the needs of the community. So again, really understanding, like, what is it that I'm struggling with, right? And seeing if that thing is in that person's wheelhouse. But the biggest component of finding a therapist is the relationship. So if you meet
Right.
with someone and you're like, I don't. they're okay. Shop around. Like I say that with every new client. Like if this is not a vibe for you, if you can't, if you don't feel comfortable with me, this isn't going to work. Like relationship is and trust is such an integral part of finding a therapist that's actually going to help you create shifts in your life.
So you said a bunch of things that are very interesting there, and clearly your blog that you mentioned will include in the description of the video below for anyone who wants to check it out. So one thing that Raquel, I just want to circle back on that you happen to mention is, once you find that therapist, right? How do you
Mhm.
actually know if you're getting positive results? Like, is that something the therapist communicates to you? Does your mood improve? I mean, can you give me and the audience just a quick example or two?
Sure. So depending what you're going in for, I think that the number one, well, I should maybe not number one, but a top thing that you should focus on in your therapy is this therapist asking me questions about myself, my experience that I haven't thought of? Like, is it thought provoking? Am I learning something new about myself? Am I gaining insight? Do I feel heard and validated? Is there a sense of lightness that comes from meeting with this person? Meaning, if I came in feeling really heavy, do I now feel like, okay, I can tackle this week? Do you feel supported? Um, I'm not a therapist who's like, here's your worksheet and are your activities for the week. I just don't find that to be something that people actually follow through on, to be honest with you.
Hmm.
It's more of a in the moment processing of a client's world and the way they see the world so that they feel, you know, like there's nothing wrong with them and they can kind of piece together the parts of themselves that have now created this symptom. So when you get symptom relief is another part of it, right?
Sure.
Specifically for anxiety or like we were talking about depression, I will use EMDR primarily or something called parts work, which I'm happy to dive into or not. But again, each
Sure.
therapist has a different way. Um, but yeah, symptom relief would be definitely a huge indicator like, okay, something's working.
Sure. So can you dive back into EMDR?
Yeah. So EMDR stands for eye movement desensitization and reprocessing. Uh, desensitization. Sorry, it is like the longest. It's the longest name, but
Good for you.
basically, what it does is it helps a person reprocess events in their life that at the time that the event happened, it wasn't appropriately processed. So it kind of gets stuck and frozen. Imagine
Hmm.
a splinter in your body that you never remove. Over time, your body starts to reject that and attack it, right? Because it's like, I know this is a
Mhm.
foreign object, and you're going to have symptoms. Same with trauma. So EMDR uses bilateral stimulation. For me, I use handheld buzzers. Some people do this with their
Hmm.
hand. Some people use a light bar. Um, and basically, the eye movements help the brain start to process memory. And it's honestly one of the most effective things I've ever used. And it has a lot of high efficacy, a lot of research. And that can target anxiety, depression, stress, assaults, like the worst thing that's ever happened to you, something that happened to you in your childhood. It can target anything. So that's one thing. I definitely always recommend EMDR to most clients um, just to see if it's effective. So that's
Well, I
that's one.
definitely learned something new right there. Yeah.
Yeah, and it's cool because it focuses on past, present, and future. So, John, if you had something you were worried about in the future, we could use
Mhm.
EMDR to help you feel at ease with that upcoming event.
Okay,
Um,
so let's put another. So lately, I've gotten to golf, right? And let's say I have a golf tournament, and I'm very nervous about it. Could this actually potentially help benefit my golf game for a tournament?
yes, because we're going to look
Ah,
at what is the negative belief you have about yourself playing golf.
yeah,
Probably like I'm not good enough, or you know, I won't be able to make. I'm not really. I don't know what the terms are, but I stink or whatever you want. And so
yeah.
we will
I'll put the ball in
target.
the woods. There you go.
So we always will look at the negative belief a person has about themselves, an emotion that goes with it, an image that goes with it, and then a body sensation. And all of those four things are what memory is comprised of. And so we just activate the different memory networks in our brain, and it's a super interesting, fascinating tool.
Yeah, very, very fascinating. I honestly had no idea that existed until just now. So thank you for
Okay.
bringing that to my attention and the audience's
Yeah.
attention. So, Raquel, why don't you tell our audience a little bit more about parts work?
So, parts work, or in other terms, internal family systems, also known as IFS. Yes, I know, lots of acronyms in the therapy world. Basically looks at the individual in terms of we are a system of different parts. And the reason I like to use this with something like depression is because it removes pathology from the individual as a whole. So I would say, John, like, tell me about the part of you that feels depressed. And I would have you kind of go inside yourself and notice, when depression is there, what part is active in your body? You might say, oh, I feel really heavy, like my shoulders are down, my chest is heavy. And I'd say, let's connect with that part of it. And we would just talk to that part directly. It's a really cool therapy. But it does help people say, hey, you know what? There is just a part that's depressed, and maybe this part is a wounded younger part of me that just needs some attention, instead of saying all of me is depressed, that's bad, that's negative, right? I try to like depathologize anytime that I can. So look for a therapist who does IFS, internal family systems, parts work. It's all the same.
One additional thing, and I'm just really curious for your perspective, right? So many healthcare providers out there accept insurance, right? With the
Mhm.
exception, I guess, two exceptions. Number one, dentist. And then number two, people who professionally work in the therapy space. They generally don't accept insurance. A lot of times from my employer clients, I'm hearing like, hey, John, like, why don't therapists generally accept insurance? So Raquel, just really curious for your take. Why don't therapists like to or do accept insurance?
A couple of reasons. I would say one of them is that unfortunately reimbursement rates are pretty low. So, whereas a physician might, I feel like a physician can see a client in 15-minute increments. And so have a
Mhm,
lot of clients that come in, bill all the insurance, and still make a living. Whereas a
mhm.
therapist, you're with someone for an hour, and that reimbursement rate is likely going to be really low. So from a financial standpoint, it's not always in the best interest of the clinician. That's one part.
Mhm.
Another part is you have to absolutely have to diagnose someone for insurance to accept it. Now, we should be diagnosing anyway, but we have to have a clinical code that aligns with this person's set of symptoms. Some therapists don't love having to do that. Sometimes therapists also have to like defend why this person needs ongoing care. Um, there's a lot of red tape. Let's put it that way.
I see. So
Mhm.
one follow-up question, right? So many people, not all, as part of their insurance benefits, they do have out-of-network coverage, right? And with
Yeah.
out-of-network coverage, essentially, the individual out there, the member needs to get the therapist or,
Mhm.
provider to fill out a form and then they submit that for reimbursement from the insurance company.
Yes.
Let's say someone does have out-of-network insurance, right? And they want to take advantage
Mhm.
of that. Is that something that therapists would typically help them complete?
Oh, sure. So that's actually what I offer, because I'm an
Okay.
out of network provider. I don't take insurance. And what I do is I just complete a super bill, it's called, which generates every single appointment they've attended, the cost of each
Hmm.
appointment, and the diagnostic code. And that gets generated through my online system and emailed right to the client. That gets submitted to their insurance. And so those who do have out of network benefits will get reimbursed for that.
Interesting. Yeah, and we've heard from some clients out there with employee noise about, the out-of-network reimbursements being low. Some are
Mhm.
considering perhaps moving their out-of-network reimbursement schedule just for therapy from 150% to 300% Medicare. So hopefully
Yeah.
that helps people out there as those reimbursement rates hopefully go up over time.
Yeah.
So Raquel, where do you actually envision the future of therapy going in the next 5 to 10 years?
Oof, the future of therapy. I think what I've seen lately is a more holistic approach to treating the individual, where a lot of somatic or body practices are now being incorporated. Everybody is looking at people through the lens of trauma, not just, I think the old school way was, what are your thoughts? Okay, here's a new thought. Now go cope with that. Let's just replace your thoughts. And there's so much more to a person than, okay, yeah, I'm having these anxious thoughts. Like we have to know where they came from. How does your body respond? What activates it the most? What is your environment like? How is that activating it? And so I think it's just becoming a lot more inclusive of the whole human, um, instead of just an antiquated, older view of treating mental health conditions.
Interesting. So let's say there's someone out there, right? Perhaps they want to get in contact with you for your practice, or we mentioned before about your podcast, right? Where can they actually go if they want to hear a little bit more about what you have to offer?
Sure. So my podcast is called Feel and Find Out. And that is where I either do solo episodes or I bring on other licensed therapists to basically just promote knowledge about emotional health. I'm really passionate about normalizing emotions. And so the podcast just helps people understand themselves better, how they relate to their relationships better. And I'm just hoping to spread the word about, let's stop suppressing how we feel and actually here are the damages that can occur when we do that. So that's on my podcast. It's Apple and Spotify is where I have that listed. And then I have a website. On my website, there's some like my blogs on there. I have a free resource to identify what your feeling type is. And pretty soon, I'm actually launching an online course
Hmm.
called Evoke, which is all about building emotional fluency, literacy, and tolerance. And so that's pretty exciting. That's coming out soon. And also on Instagram, you can find me. That's kind of where I hang out the most.
Cool. Well, that's the fun spot, right?
Yeah.
So, Raquel, really appreciate you coming on the show today.
Yes. Thanks for having me. It's been a great talk.
Awesome. Definitely learned a lot along the way, especially about the light therapy that you mentioned. So, we want to hear from you guys. If you are in need of a therapist, what qualities would you look for? Comment below.